water stress. Farmers in the Comox Valley have been among the first to have their livelihoods impacted by water stress and water license restrictions. What should the province do to enact preventable, equitable water policy that ensures ecosystem protection as well as food production?
Thanks for showing up, everybody. I appreciate this opportunity, even though I'm extremely nervous about it. What I believe is you can't hear me? Oh, I'm sorry. Oh, I am so sorry, you guys. I'm going to try and stand up. No, the mic only goes up to the camera here. Yeah, I'm so sorry. Yeah. So, but anyway, what I believe we need to do is we really. Holy cow. I am so sorry, everybody. You guys all worked very hard to come here today for me.
This is an important question.
It is, absolutely it is. And a big thing, what we need to do is we have to have a good water group plan in place, a good water group that consists of the farmers, the indigenous communities, and the environmental groups. And we have to throw in a mediator also, because water is our most precious resource we can have. That's one resource we cannot live without. So we have to start up a water group so we can come up with a proper plan that gives the proper watering rights to certain times of year to certain areas. Now, dairy farm is a lot different. Dairy farm needs a lot more water than what a lot of other farms do, because they have to have so many cattle they're feeding. So we have to figure out a way they're still going to keep them, because we don't want to lose our dairy farms to the States. We want to keep the dairy farms here. But at the same time, we need to keep all the other farmers going heavily. That's why we need this water group. We need to have it all set up where it's, like I say, a community of the farmers, the indigenous, and the environmentalists with a mediator. Once this water group plan is done, the only thing the government should have to do with it is police it. Because once the government puts any amount of their logic into it, the entire plan is kind of out the window, because it doesn't work for everybody then. The plan is the plan. That's one of the reasons we need to invest in more water storage. So the rainwater we get every year, the snow runoff, dugouts, whether it be dugouts, whether it be large capacity water towers, we need to start harvesting what we are given. Because if we don't harvest that, then we're definitely not going to have enough water. Plus, we can also look into a lot of the farms going into more of a drought-resistant crop. Now, that doesn't help with certain ones, like the corn needs lots of water. We know this, but other crops can get into more of a drought-resistant crop. Once we have all of those set up, I think I do believe we'll be able to help everybody in the situation with the resource of the water. Is there any questions on this? For the people that heard, I'm sorry.
Question. The majority of our water comes from the Comox site?
Yes. Yes.
Correct. Are there other water sources back in there that can be tapped into, such as on the North Shore, Capilano Dam and the other one?
The John Hart Dam.
They're connected.
Yes. All the water is actually connected in a major way, because there's the Comox Lake is a strange lake. It's a lot of parts they have no idea what the depth of it is, and there's caverns that go into other lakes on the island that are quite far away. So the lake is a massive water. Oh, shoot, I am so sorry, guys. Yes, but like I say, we do have to. BC Hydro does very well with controlling the amount of water that's in there, but we have to look at more for the farmers that are away from that area. We need more storage, whether it be towers, whether it be each farmer starts collecting their own water. It'll never be enough, but every little bit is what's going to help on this. And like I say, the government has to stay out of the plan that the water group comes up with. That plan has to. Oh, I'm sorry.
Well, one of the issues is the fact that this new licensing has come into effect, which means I collected in a rain barrel and I have to pay for that.
And that is completely wrong.
And that is wrong.
That
It's
is
like,
completely
it's
wrong.
one thing for me to do it for my garden
Yeah.
at home, but to charge farmers that have spent all this money to do
It shouldn't be
dugouts-
charging you either.
No, I know, but I'm just
like,
saying that
yeah.
that's why this has become a big issue, is because the farmers now have spent tens of thousands of dollars digging dugouts,
Yeah.
and now they have to pay a license.
Which is
to use that water
so
that they
wrong.
collected from the
Yeah. It's definitely not something that wouldn't have my vote attached to it. There's no question. Yeah.
Well, that happens now. Why don't we raise
I'm sorry, I got two people going going here. Use which?
Farmers use rain barrels.
To a point they do, and yes, and that's why I say a lot of it could be into water towers. So when you're collecting the rain, we can pump it into water towers.
They're
Yes,
still having to pay for that.
yes, of course, yes. And
Why don't we raise the level of the lake? That seems the sensible thing to do.
yes, and we do raise the level of the lake. We do control the level of the lake because that's also where our power comes from at the same time.
But obviously not enough.
Yes, but there are times of the year where there's not enough runoff at that point. And so there's quite often that our power plant at Comox Lake actually stops generating and the power comes more from Campbell River. So we do start to run as the drought gets bigger and bigger, we do start to run out of water in that lake. Well, enough to generate the amount of power that we need anyway.
Yeah, but what I'm saying is, so there is always enough as to raise it high.
Yes, and yes.
It has to come from somewhere.
Yeah.
You've seen
Comes
the
from the
gla-
sky.
Yeah.
but the glacier is also
Yeah. I'm sorry?
I have a point of view about companies who want to drill and sell water.
Yeah.
Nestle.
I'm not for that. I'm really not. Like we do, there are certain areas that need bottled water because their wells aren't good for consumption. I'm so sorry, everybody.
What I'm going to suggest is, again, we run into acoustics here. I'm going to encourage people at the tables to wrap themselves around the table of the candidates sitting at, and if they would like to do that, to be a bit closer. And it may also help if the candidates stand up to answer questions. So we're going to move on to the second question here. As soon as I do what I did with my time right there. Okay. Okay. So the next question is coming from the Comox Valley Social Planning Society. The current earnings exemption limit for those receiving benefits from the Ministry of Social Development and Poverty Reduction does not meet the needs of people receiving benefits, and it is unnecessarily bureaucratic in practice. If elected, what would you do to support the call from 50 nonprofit leaders, advocates, and community partners?
Thank you.
in poverty
Thank you.
and
Thank you very
disability
much.
rights sectors to abolish the earnings exemption limit for people receiving income assistance, including those with persistent and multiple barriers and those who are receiving people with disabilities benefits?
This has actually been a topic that I have always had with my family. Having that in place does not help the people that are trying to get ahead. So what happens is they're allowed a certain amount of money. So let's say they're allowed $500 extra of what they're given. So then they're offered a little bit of overtime on a job, and now so they take that overtime because they want to get ahead. They want to, maybe Christmas is coming up. They want to treat their family good. They want to do anything they can. Well, now they've gone over that $500. Now they're cut off. That's not right. I mean, these people need a chance to be able to get ahead. If we don't give them their chance to get ahead, they never will, and they will never ever get off the system. And I mean, as for the special needs, they need all the help they can get. I mean, if they get a job and they can have as many hours as they want, they deserve that. Take a look at what they're going through in life to begin with. I think we can be quite compassionate to them, and that's one of the things our government is missing is the compassion that it needs. Any questions? No, that's it on that one? Really? I thought for sure it'd be more on that one. I mean, I got a lot more written down, but that's a that's a suffice of it.
Answer that lady's question, the last question, you ran out of time. You want to hear a fuller answer?
Oh yes, that's a good idea. Yes, yes. Can I get you to repeat that question again? We'll start over.
What is your point of view?
Oh yes, yes, yes,
In selling
yes, and
sometimes U.S. companies.
exactly, and I am definitely against any U.S. companies coming in here to begin with, but as for the groundwater drilling, certain areas do need bottled water. There's no question about that. Their water just isn't potable from their well. That's understandable. So we do need some, but I don't think we need the amount that people are trying to drill and trying to make the profit off of. There does need to be a difference. It's either that or they jump into desalination and spend money on desalination and figure out a way to suck the salt out. Only problem there is you got a lot of salt to deal with after that. There's always a byproduct when you're done. So, no, it really doesn't need to happen. Yeah.
Surely the man who's making money out of salt water, he won't make money, then that won't happen.
yeah.
He won't have a business.
And that's
Go elsewhere.
yeah, that's exactly right. That's why I say there needs to be a limit. There truly does.
All these aquifers are under people's houses, and they get their water from it. And everyone is frightened that the water will go down so low that they won't get any water.
Yeah,
Private people are making money out of it.
yeah, and that's why I say there has to be a limit. There really does. Yes.
General plan in place to stop the foreign companies from taking our water?
From taking our water. Like I say, I'm an independent, so I can have an idea in place, but I can't have a plan in place. But if anything comes across the table to start selling our water, no, my vote is no. It's that simple, because that water is, like I say, is our most precious resource, not only for us but for our livestock, for our vegetables, everything. There's nothing we can do without the water. I mean, it's hard to believe we can live with anything without oil, but we can. Just not very well, but we can. Every oils and everything, but we can live without it. Water we cannot. So we do have to protect that. No question about it. Any other questions?
Have you lived here a long time? Do you understand?
My wife and I moved out here in 2013. My parents moved out here in 2008, and I've been coming out for vacations ever since about 1986. 1986, we came out to visit an aunt and uncle that were living here at the time, and I fell in love with the place instantly. And then, so my concentration was, what can I do to move out there? And eventually, I had a young man 13 years ago, or no, sorry, 10 years, coming out 11 years ago now, and I had a talk with my wife, and didn't take long to decide that we're going to move out here. So in 2013, that's when we decided to move out here. Saskatchewan. Yeah. Yes, they're they're not tasty water at all.
Candidates, you have 1 minute. 1 minute.
Any other questions? I'd be happy to answer anything at this time for the last minute. Not yet? Okay. Oh, yes. I'm an electrician by trade. So for quite a few years, I was electrical superintendent. And then when my son was born, I didn't want to be away from him. I was enjoying waking up with him every day, so I decided to give that up and go back to being an electrician. Yeah, and so that's where I learned budget controls and man hours, unit rates, everything to try and keep a project under budget. So, and it can't always be about the money, right? Sometimes it has to be a moral reason too.
15 seconds we have left. Have you ventured into politics previously?
Okay, time is up.
So I'll get you on the next one.
Time is up. So please wrap up, and we're going to go to the next question. Okay. Okay, so the next question. So if candidates could just wrap up, great. Okay, so the next question question is from the Early Years Collaborative. Okay. Given the success, can I just ask the candidates to wrap up so we can ask the next question? Thank you. Okay. Given the success of the current Child Care BC plan, which includes the $10 a day child care and the immense positive impact it's had for families with young children, what do you intend to do to make sure that the current plan continues with dramatic increase in the number of high-quality $10 a day spaces, and any future plans includes a fair wage grid for early childhood educators, including access to quality post-secondary training? Yes, and just again, this question comes from the Comox Valley Early Years Collaborative.
This is another one that's to my heart, always has been, even before I had children. I had lots of friends that were low income, not even low income, but the fact was they had children, they were spending ridiculous amounts on childcare. When they came out with a $10 a day childcare, I thought it was fantastic. The only thing I didn't like, I would rather seen $5 a day childcare. I am all for it. I would like to see more money thrown into it. I would like to see absolutely the childcare workers themselves, they get the worst end of it, because everything they do to keep the low $10 a day, they will never see an increase. No matter how many times you see the 2%, 5% inflation, they will never ever see that, unfortunately, because they have to try and keep it low enough for other people to have their children into child care. So absolutely, I would like to see more money go to them. I'd like to see an annual raise for them, because they deserve it. To me, a lot of the money for all of these, where it has to come from, is budget cuts to the legislature, not budget cuts to teachers, not budget cuts to healthcare, budget cuts to the legislature. I mean, how much money do we waste every year just on paper? Like, take a look at all the paper shredding companies. So much of that money could have been spent somewhere else, just on a stupid pen that people just can't seem to keep in their pocket the whole time. All of those cuts can come from legislature, not essential workers. So to me, I am all for the daycare, $10 a day. If anything's less than that, when you have more people working in the field, you have more income tax coming in. That's more money that they're able to spend, which is more sales tax, more everything. That is, no matter how you look at it, that's more money that's coming in for the province, not just one person. So yes, to me, I am all for the child care. Well, like I say, to me, a lot of that money has to come from budget cuts of the legislature themselves. Okay, they have such an overabundance of money that they spend, but yet instead of taking away from that money, they take it away from the teachers. They take it away from the health care. They find all sorts of places to take it from, but their own pocket. And like I say, when you have the money going into childcare, that's more families working. If there's more families working, that's more income tax coming back in. So.
I was just wondering, and I guess this is really federal, but taxing people over a certain income more, so that there is money to spend on all the social services that are so desperately needed.
Yeah, yes, and I mean, even that, I mean, you take a look at the amount we're being taxed. We do have a very high amount being taxed. Where the problem is when you get into these multi-billion-dollar companies. They're paying very little tax for the amount that they're actually bringing in. Take a look at a bank alone. Banks make billions of profit every year, but they pay very little tax on those billions.
Structure of the federal and provincial taxation.
Yeah.
I don't know how much there is to raise taxes.
Yeah. Well, for provincial level, there is a point that we can raise it. But it also comes from federal too. It is a two-way street on that. There's no question about it. But the higher tax is the federal portion of it. Because I was just wondering if you had some. No, you're still thinking. Okay. It's, anybody else?
Just wondering if you know, are there enough daycare spaces in the province for those patients?
Absolutely not. Absolutely not. Long waiting list. Like my son went to Beaufort up at the university. The only reason he got into Beaufort was because my wife was a full-time student. He would have never gotten in. We've got friends that had their kids on waiting lists before they had babies, and they still could never get them in. You know, so the only well, that's just it, because that has to be something that comes from everybody. Because I mean, we can offer more to put daycares in houses, so it's more of a home care than it is a daycare. We can have those type of programs going. All of those things for people to do. If we were to give them a very small low interest loan, these low interest loans would be paid back because they have an income now coming into their house. Since they have an income coming into their house, that's more money they can spend. That's more tax money that comes into the province. So I mean, to me, it's just you do have to put the loans out there, because they're always going to be paid back. These people, if they have a home business that's working out for them, that they're successful with, they'll do everything they can to keep that home business. You know? And to me, and like I say, to me, for when it comes to childcare, we have to have it. There's just no question. You know, who's going to take care of the next generation, and the next generation after that. And the way the government has been going, they've only been worried about 8 years worth. You know, after that they'll be retired and move on, and they aren't going to concern themselves after that.
Talking about family daycares.
Yes.
All right, candidates, we're done with
I'll
that
catch you on the
question.
next one, though.
Move on to the next one. So we've had a couple of questions. We are going to do 6 questions at each table, and then the candidates will move. Okay? So we've got a few more here to do. This next question comes from the Immigrant Welcome Center. And the question is, between 2016 and 2021, 775 new immigrants came to the Comox Valley. How do you feel our community is doing in welcoming newcomers? And what recommendations does your party have around immigration going forward?
With this one, this is another one that hits quite close to home, because my wife is an immigration consultant. My wife is an immigrant herself. She came from China. So this is another one that actually I'm quite deep into. And a big thing with this one for welcoming the newcomers is we have to more community engagement would be a big thing. More classes for improving their English. But more help. A huge one that's always been a thorn in my side is give them a chance to do what they've been doing at home for a living. So if they were a doctor at home and they've been saving lives at home, I will guarantee they can save lives here. I mean, maybe their schooling isn't quite up to par, but for them to be driving taxis isn't right. I mean, that is a huge problem with the immigrants. I mean, we've got ones that acted as plumbers, as electricians. From their country, it's not the same schooling, but electricity does still work the same. So we can still get them into a small course, get them up to speed, and get them into an apprenticeship to be properly licensed as a tradesman they were back in their country. Same as if they were a nurse in their country. It doesn't take much for a nurse from, let's say, the Philippines to get a job at the hospital to do nursing duties at the hospital. Maybe they can't do the duties of an RN, but I'm sure they can do duties of an LPN or close to it. This will get more workers in the hospitals. This will help the immigrants, the immigrants coming in, and it'll help the healthcare at the same time.
I mean,
I haven't seen any schools advertised for English second language.
Yes, ESL schooling? Not here, I don't believe. There are other places I've lived. They had them. They had courses for them at different libraries and stuff. But I'm not sure if they actually have ESL here. That's definitely something I'll look into, though. Yes. No, but that's definitely something I'm going to look into. ESL. Anybody else? Just scan this direction. No?
Well, you were talking about doctors or
Yes.
whatever their occupations were, but there's a whole series of federal as well as provincial requirements.
Absolutely, absolutely, there
And
is.
there has to be an appetite to see
Exactly,
us.
exactly, and that's a fight that we have to start at our level.
And they
You know.
charge so much for them to take their
Exactly, and it's and years worth that of all the stuff that they already know. You know, like I say, I mean, they've been keeping people alive in their own country for a long time. I know they can keep other people alive here too. You know, and I don't know. It's one of those things that you get pretty sick about. You know, but and I mean, it's the same thing with the schooling too. I mean, we give, I believe, close to $500 million every year to the schools for the medical board. Well, to me, unless they're actually going to start letting these doctors in, to me, we hold that half billion ransom, because all of a sudden things are going to start changing. There's no question about that. Yeah. They can't go without the money.
Doctors that are coming from other countries, shadowing a license.
That's exactly it. We've got so many, yeah. We've got so many options we can do, and I mean, and I mean with the shadowing, 6 months, maybe it's not long enough, maybe it has to be a year, but the fact is they can be working as healthcare workers. There's no question about this. I see nothing wrong with it. They need it. Yeah, well, absolutely, they need to speed it up. Yeah, yeah, and I mean, onto a sidebar of this where it has absolutely nothing to do with this question, and I apologize for that. But you take a look at a lot of the people more wealthy. They want to see privatization come in. Well, privatization comes in, that doesn't fix the doctor and nurse shortage. We still have the same amount of population, so privatizing will not fix any of that, not one bit. You know, so no, it's something that has to be dealt with. But no, I'm all for helping out with the immigration. You made a good point of why there isn't an ESL class here. There should be, absolutely, there should be.
I worked in the health industry and I know a lot of people when they come in as immigrants, farmer learns English.
Candidates, you have
Oh,
1 more minute.
I'm sorry. Oh, no, okay, we're good.
The children learn in school. The mum is staying at home with the doctor's very anxious job. She is always the one who's struggling with English. Even when they get to the 60s or 70s, they barely can speak. The children have to take them to the shops and buy.
Yeah.
So I think there should be maybe some special areas.
Absolutely. Yeah, there's no question. And I mean, the thing is, you don't even need to be an actual licensed teacher to be part of an ESL program. I mean, I took an ESL course back in 2005 because I went to Taiwan and I was going to teach English there. When I got there, I was put in a school that went from age of diapers to age 8. So I knew quite soon that it wasn't for me, so I chose not to do it. But no, you're absolutely right. The biggest thing is they have to have the chance to actually use the English.
All right, that's a minute. If you could wrap up your answers, candidates, we'll move on to the next question. Thank you. Okay, so this next question comes to us from the Pride Society of the Comox Valley. So across Canada and the U.S., various governments are creating legislation to minimize the rights and safety of queer and trans people, or they're taking steps to outright ignore current legislation meant to support the legal rights and safety of queer and trans people. In Canada, we've seen such actions in New Brunswick, Saskatchewan, and Alberta. So first, the question is, what specific steps will you take to ensure that the elected government party does not try to eliminate the legal rights of queer and trans people, including youth in British Columbia? And if you are a member of the governing party and the party tries to minimize the rights of queer and trans people, how will you stand up? Finally, if you choose to follow the lead of a governing party in minimizing or eliminating the rights and safety of queer and trans people, how should your constituents hold you accountable?
Well, luckily, I am not part of a party. Luckily, I'm independent. I have a right to vote exactly what the taxpayers and the people of Courtenay Comox want me to vote for. When it comes to taking away rights, you can't take away rights. Not to me, because we fought so hard for rights to begin with, and now you want to take them away. Once you start taking some rights away, all the rights start disappearing, and you can't do that. So if they vote to take rights away, my answer is no. There's absolutely no question about that. And like I say, they can't stop me from voting no because I'm independent, and that's the great part about being independent. I can be partial to every single group out there, and not be worried about what my party leader tells me what I have to and don't have to vote for. So no, I will not vote for removing people's rights. It just can't happen. No, I understand that. So, some people it's a hard topic. Some people are against it, and in Canada we have the right for it to have that either direction. It is up to you to have that. That is your right. I can't stop you from having that, and you can't stop me from having my opinion at the same time. So that is a right that is something I wouldn't be able to do is vote to take somebody's rights away. You know. What's that?
Trudeau Sr. summed it up beautifully when he said the government has no place in the bedrooms of the nation.
He's absolutely right. Yeah, no, he's absolutely right. You know. I mean, I've never understood the problem with it. I mean, they aren't bothering me. You know, I'm quite good friends with a lot of them. I don't understand where the issue is. I don't get it. So no, I would vote no on removing people's rights. There's no question about that. Yes, sir.
Points on the curriculum that's happening in the schools related to gender issues?
For the SOGI 1, 2, 3, I want to be able to be the one to teach my son about that. There's no question about this. The problem is, a lot of parents aren't teaching their children about this. A lot of parents they're teaching a lot of hate, and so that one is so hard to decide on what needs to happen. But it might need to be calmed down a bit, because they are going a little bit heavy with taking away the rights of a parent also, because I do have a right to teach my son a proper way, whereas a school curriculum might not agree with what I say. Now, I know they would agree with what I say, but at the same time, rights are rights, and I mean, we need to be able to teach our kids. You know, I mean, we have options. There's all sorts of different options we can do, but as for teaching my child one thing, and me not find out about this until he gets home, that's kind of wrong too. I've got a right to know what my son is being taught. So, what if at one time there's a group that comes in and they say we shouldn't be allowing so many immigrants in? Well, that's a right that you're taking away from somebody again. Rights and freedoms are rights and freedoms. Everybody has rights and freedoms, you know, and I do have a right to teach my son. My son, you know, it's very important to me. Very, very important. You know.
But you don't have a right to take away that teaching from other kids whose parents might not.
That's right, but a lot of times these teachings, we don't hear about it. We don't know what they're teaching when it comes to that curriculum. And I still haven't been given anything from the school about that. Now, like I say, I teach my son quite well that you show them respect, you show them the same respect you show everybody else, because they are human beings. That's the most important. You show them the respect. But then after that, I think a lot more has to be discussed with the parents themselves before all this goes into the schools. And
centuries.
Oh yeah. Oh yeah.
I mean,
Yeah.
it's accepted by other.
Look at the Greek civilizations. The ancient Greeks. Yeah.
Why are we living in the dark ages?
Yeah, that's right. It's something that needs to be. Yes, sir. I'm trying very hard. I apologize for it. There is room over here. Yeah.
I can sort of hear you, but I think.
Oh, okay. Okay. Yeah. Do you want to come over here so you can hear a little bit more? Oh, okay. Okay. Yeah. Yeah. Any other questions?
Candidates, we have 40 seconds left.
I forgot to get back to you guys.
No, I was just going to throw it.
Yeah.
As an independent MLA, what do you see your role as?
My goal is to help the people of this, help the people of British Columbia, because like I say, every party has some great views, but every party has some horrible views, and every candidate has to follow those rules whether they want to or not. For me, I can pick out only the great parts that I want to vote yes on, whereas the ones that the constituents that the voters don't agree with, I can vote no on that. You know, I can vote yes and I can vote no. All the good. Sorry.
Wrap up your answers, please. The next question, our sixth question, is coming from the Comox Valley Coalition to End Homelessness. And the question is, even affordable housing options remain out of reach for many who are most vulnerable. What specific policies or programs would you support to support, what specific policies or programs would you support to support those who can't afford existing affordable housing options?
With this, we need increased and subsidized housing, because unfortunately, if we don't increase the subsidized housing, they aren't going to get off the street. Rent control measures, a huge portion with the rent control we have, just because the cost of living went up 2%, doesn't mean that a person got a 2% raise that day. So rent control, they could still raise their rent to 2%, but there's a good chance that the person living there did not get a 2% raise. So that's not helping. The rent control isn't helping as much as the way it should be. So we need to address that. Cooperative housing modules. I mean, we take a look at Maple Pool Campground for perfect example. They have the sea cans. So it's basically a studio sea can, 20 feet long by 8 feet wide. It has a sink, a toilet, and it's got a bed in it. It's great for a lot of the homeless. They've helped out so many people that were on the street, got them into this, and now they're slowly improving their lives. It's still a long way to go, but it's slowly improving everybody's lives. Supportive housing programs. It's all sorts of programs that we can do, which will pull the people off the streets. It's one of the most important things, is get the people off the streets and get them somewhere warm. You don't get them somewhere warm, their mental health will never, ever, ever improve. Their mental health will always keep declining, and we will never, ever help them. So it's a very important subject on that one. Yes, sir.
We've heard that Victoria each Wednesday is shifting their homeless problem off people who are more violent into the Comox Valley. Is that true?
Not that I'm aware of. I have heard that, but it's not that I'm aware of. I mean, I'm in Victoria quite often. I have heard that rumor, but there's no way of me substantiating something like that. I would have to. It does seem like it's getting bigger and bigger. I've got no question about that, but I can't. That's something I can't. Unless I have hard concrete evidence, I can't say yes, it's happening, or yes, no, it's not happening. I hope it's not happening. Yeah.
That's one of the reasons why we got more people coming in, because they're being shifted.
Yeah.
And we don't have the resources to deal with it. If we Victoria doesn't have the resources,
Yeah.
we certainly don't.
Yeah, and we didn't help with Ralph Klein either in Alberta with him sending them all over here on a one-way bus ticket. You know.
Response to it.
Yeah, yeah.
Nobody wants to take it on.
Yeah, and it is getting bigger and bigger, a bigger and bigger problem. There's no question about this. And like I say, I have heard that rumor, but I've never seen the actual proof of it. You know, if it is, I mean, yes, sir.
Do you think that housing is a human right?
Yes. Yes.
And on other issues such as water, you've said that we need to make that available to everyone and keep it available.
Yes.
Do you think that the capitalist system of housing is able to do that?
To me, we have no choice. We really have no choice.
Go to
You know.
other means.
Yeah.
Like after the war, the federal government built a lot of housing.
Yeah. Yeah.
And it was not capitalist. It was, you know,
Yeah.
and that continued until the 80s and 90s.
Yeah, and I remember my grandma saying that when they built all those houses, there were people that would just be showing up for the application line because it was such a long application line. There'd be people showing up in their pajamas because they knew they were going to be there all day anyway, but they were going to have a house when this is done, so it was absolutely worth it. You know, everybody got houses, everybody all of a sudden got jobs, and the economy spiked, and it was great. It was great for everybody. Unfortunately, it was a system that was somewhat fixed, that's now slowly been crumbled apart, and it's becoming a system that's broken and needs to be fixed again. You know, so we definitely have to fix it. You know, absolutely. Yeah. Okay, there was somebody over here asked a little while ago that I didn't have time.
It was just about child care.
Oh, okay.
You were saying that we need more family child care.
Yes.
In home.
Yes.
I have a little bit of knowledge, and my daughter owns a daycare.
Yeah.
Candidates, you have 1 minute.
Some of the family daycares are atrocious.
Oh.
Because they have no
Yes, we have.
training, there's no licensing.
Exactly.
There's nobody making sure that they're maintaining a certain level.
Yeah, and there does have to be inspections, and there does have to be licensing. There does have to be the workers themselves have to be trained. There's no question about this. All of that has to happen, and I mean, once again, yes, it's more money, but it's money that we can't walk away from. We have to do it. We have to look into generation at this point, not just 8 years from now. You know, it's the only thing we can do.
Right now, it's some of them are pretty atrocious.
Yeah, and I believe that. And like I say, it's a biggest problem that I find is whenever we come up with a law to do something, we don't bring out rules with this law. A perfect example is legalizing marijuana.
So unfortunately, that's all. Question here is from the Comox Valley Senior Support Society. And here's the question. A significant number of people, including children, youth, adults, and seniors in the Comox Valley do not have equitable access to many activities or services. In June 2021, the provincial government passed the Accessible BC Act, which requires local government and organizations to take action on accessibility in communities across BC. So here's the question. If elected, what will you do to work with all people with disabilities in our community and with local governments or organizations to achieve accessibility and universal access for all members of our community?
Sorry, guys. Okay. Everybody can hear me now? Everybody? Okay. Sorry about that. We're having a hard time with this one. With the seniors, we do need more programs. We do need more help with them. We do need more collaboration with the seniors of what they need. We need to be standing up for them because they're the ones who raised us. So when it comes to anything for them, yes, we do need to help them. We do need to give them programs, no matter what the program is. You know, even if it's just a drop-in center for them to have a communication with somebody every day. We do have a few things going, like Nurse Next Door. We have something like that going. All of these programs are fantastic for the seniors, and we do have to support the seniors 100%. So if there's any type of budget cut for that, it's not on my voting card. The card would be no for something like that. Any questions? Sure.
I've never met you before, so I wondered, would you mind telling us just a little
Sorry,
bit
I'm.
about yourself? Because your brochure doesn't describe
Yes,
you.
yes. My website actually has an about me page, but yes, I'm Devin Howell. Moved to Comox Valley in 2013 when I had my son. My wife and I, before we had my son, we lived in Saskatchewan and Alberta. Moved back and forth for work all the time. I've been coming out here since about 1986 for vacations, because this is where my aunt and uncle lived for a short time, and at that time I fell in love with the community. So ever since then I was doing everything I could to be out here. And then my parents moved out here in 2008. Gave me more reason to be out here all the time. And then, like I say, my son came around in 2013. And I've turned it into a kind of a softie with my age, and I didn't want him to walk to school in the same weather that I walked to school in. So my wife and I chose to move out here. At first I was still electrical superintendent. I've managed quite large projects in the past, but then after he showed up, I couldn't stand not waking up next to him. So I gave that up. We kind of rearranged our entire lives. We sold the house we were living in. We bought a retail store in town here, and my wife, she works a retail store. I work as an electrician for another company now, and I've decided that now I'm going to try this and see how things go. I guess the best way of saying it. I do believe I can make a difference. I do believe I can support the taxpayers of the Comox Valley. And but yes, sir.
Yeah, that's just about disability. I'm wondering how you feel about the support, money-wise, for people with disabilities.
They need more.
Severe.
No, absolutely, they need more. I mean, not only in their pocket, but take a look at the support we have. If somebody's in a wheelchair and they need to get from here to Victoria, well, they can ride city transit now, which is a big help. But that's a lot for them to be going on and off several buses to finally get down to where they're going. They need Handy Dart to be able to take them right to where they need to be for their appointments. They don't have enough support, and it's not to any fault of their own that they don't that they're in the condition that they are. So no,
I'd just like to add that the shelter portion is under $600 a month.
Yeah, exactly.
For a disabled person.
Yeah.
And I challenge anybody to find how any
Exactly.
form of suitable housing for under $600.
Exactly, and that's the saddest part, because you take a look at my career when I was working out of town all the time. We were given a per diem to work out of town. That per diem was to cover all your living expenses, your food, your travel, everything. And that per diem in Saskatchewan was about $110 a day. So how do you expect anybody to live on the $600 a month that you just said? You can't. Especially here, you can't do it. Sorry.
Especially seniors, as more and more leases come due.
Yep.
Or they end up being charged rents, because a lot of seniors still are paying non-market rents. They're paying rents from 10 years ago.
Yeah.
But as landlords, more and more landlords raise the rents.
Yeah.
We're going to find more and more seniors.
Yeah.
Unless the government does something.
Exactly. And there's no reason there can't be any type of a program for that. I mean, there can be senior living. There can be zoning for senior living for the lower rent for the seniors. There can be zoning for the senior and the people that are unfortunately in wheelchairs. You know, they can't. I'm sorry, guys.
Answer, please, and we'll move on to the next question. The next question comes to us from the Comox Valley Substance Use Strategy, which is operated by the Indigenous Women Sharing Society. And the question is, there has been a lot of conversation in the media about the recent announcement of plans to increase involuntary treatment for those with acute mental health and substance use issues, which many experts do not support as the evidence shows poor rates of success. Further, there are often harms from human rights violations to higher risk of death from the unregulated drug supply after release. Do you support involuntary treatment? And if so, how will you ensure it is to be effective, evidence-based, will minimize harm, and provide long-term success for patients?
When it comes to the involuntary treatment, some people, they do need it, unfortunately, but not the amount that they want to do. A lot of people, you put them into involuntary treatment, when they come out, it's going to be the same problem. We have to help more of the mental health portion of it rather than force them into treatment. Because when you force them into treatment, it doesn't change. They come out and they unfortunately have the same problem. I've got a friend that has this problem where his sister constantly is into treatment and then she falls off. She goes into treatment, she falls off. And now if it was involuntary treatment, it would be the same thing. So what we need more is a comprehensive mental health and addiction service, which includes the harm reduction. That's more what we have to do. And like I said before, the systems like what Maple Pool Campground has set up with their 20-foot sea cans, it's one of the best things I've ever seen, because so many people have come off the street, gotten into one of those sea cans, and it has helped them tremendously. I mean, their brain is rewired in a way that it might not never help them completely, but it helps them, and it gets them off the street, and they have a sense of worth at that time, and that part of the mental health increases for these people, and so many of them have actually gotten away from the illicit drugs. Unfortunately, sometimes they do fall back in, but they're still there for them. Like there's still help for them. So I don't know. To me, the involuntary treatment isn't always the answer, unfortunately. And I mean, to a small point, it is, because some people it's basically to the last point. We have to try it, or he's not going to be around anymore. She's not going to be around anymore. But I don't know if I'm 100% on the involuntary treatment portion. I'm sorry, I kind of looked straight at this way the whole time, and I shouldn't have been.
Do you recognize the need for wraparound services?
Oh yeah.
You mentioned housing. I mean,
oh yeah.
one thing to put a person into house.
Yeah.
Do you recognize the other needs that are?
Oh yes. Of course. Like I say, I mean, it's not a foolproof plan of what we can do, because every single person is so different, and we have to slowly. Unfortunately, it's something that's going to have to be a long process to be able to help everybody, and the involuntary treatment, as much as I would love to say it's going to work, I don't think it will, because I haven't seen it work yet, unfortunately. Any other questions?
Here we are today trying to function with our issue policy.
Yes, sir.
How are you going to make the downtown safer?
Well, like I said, we need more programs for them, like the Maple Pool. That was that was a great thing. We need higher levels of that. A big thing is, once these people have a sense of self-worth, because a lot of times they don't, unfortunately, once they get to that level, unfortunately, they need to concentrate more on what's going to get them to their next fix or whatever else, rather than what's going to help them. You know, a doctor once told me that the problem with the opioids was it rewired your brain thinking you need it all the time. Well, now we need to figure out a way to rewire the brain that you don't want it at all. You know, so, and that's going to take more money into mental health. There's no question about that. Yes, sir.
There are many levels of government here. Which level do you think should be tasked primarily, given the resources to deliver help? for addicted?
To me, it needs to come from all levels, because that's the only way you're going to get enough money for it. It needs to come from the federal, it needs to come from the provincial, it needs to become.
I know, but who would be the prime level of government to address people on the street?
I
think it's the municipal level.
Yes, and that's exactly what I was about to say. To me, it should be the municipal, because the problem we have here, it's like, let's break down Courtenay even more and pretend that Courtenay is a massive city. The problems in Crown Isle isn't the same problems as what's on Fifth Street, or on Cliff Avenue. So yeah, to me, it should be the municipal level that controls how it's done. There's no question about that. Yeah. Any other questions?
And that's reality. We have to educate our kids better in school. The hard and
Take that as a no? Yeah.
I don't want to ask another one.
Well, I might be able to come back to it. Last time I was able to come back to it, so go ahead and ask, and maybe I can come back to it.
Well, as we're seeing here in Courtenay Comox, the new center for helping the homeless and moving the Connect Center, how do you resolve?
Okay, that's all the time we have.
We will get to
How do
it.
you resolve the conflict that brings to neighbors?
Yes.
The
Yeah.
next question
We will get to it.
comes to us, and we're back around again from the Comox Valley Food Policy Council. So in budget 2023, the province of BC invested $214 million over 3 years towards school food programs. If elected, how would you support school food programs for students across the province? And how would you ensure that both legislative policy as well as funding is supported?
I'm all for the food program. If anything, we need more money to it. There's so many kids that are going to our schools with empty tummies, and it's not right. There's absolutely nothing that child did wrong to be in that situation. They need more food for them. They do have a breakfast program at my son's school, which is great. My son doesn't go to it because he doesn't need it, but it's great because at least there's some food for them. Throughout the day, a lot of kids, they start getting pretty hungry and they ran out of lunch. There's food for them. If anything, that's another thing that needs more money, and to me, that's something that has to come from budget cuts from the legislature building itself and the offices of the MLAs. The government always wants to do budget cuts to healthcare, and they want to do budget cuts to education, but they never want to give budget cuts to their own system. So to me, cut the paper budget at the legislature, cut the amount of pens we're buying at the legislature, and I'm pretty sure we can feed all the kids in this valley because of that. Yes, sir.
How much exactly do you think we'll be able to save by cutting the pens in the legislature?
Well, like I say, I was a electrical superintendent, and something we found, if we left the pens, the jiffy markers, the paper, all of that's unlocked for anybody just to help themselves at, we would spend probably almost $30,000 on stationery as opposed to spending $10,000 on stationery. So now you look at a bigger level of Parliament, where it's the big house in Victoria, and then every single all 93 or whatever it is constituents after that, with the budget they have, we can save a lot of money in there. I mean, this office alone, I believe it's $150,000 a year that they're budgeted for that office. We can get that lower. We don't need to spend $150,000 a year. Yeah. Yes, sir.
Just so I understand, you're saying cut the MLA budgets?
Yes, absolutely.
And you're saying 150,000, but they're.
That's what they're getting. I believe that's what they're getting now. No.
But a living wage.
Mm-hmm.
I think everyone should have a living wage.
Oh yeah.
I know political. They have staff. One staff at 80,000.
Yeah.
So.
Yeah. So okay. So it's $180,000 you can get an office for $1,000 a month. That's what my wife pays, and she's got a much larger office than what she needs. So
yeah, I don't need to
yeah.
get into the
Yeah.
nitty-gritty here. I'm just
Yeah,
saying.
yeah. But what I'm saying is,
I don't find $150,000 for my elected representative to be able to serve all of the constituents as excessive.
well, yes, yeah, no, I get that, but at this, I'll get you in a quick second here, but I get that, but at the same time, how much are they cutting from all these other programs and expecting them, like the healthcare alone? How much are they cutting from them and expecting them to do it anyway?
Would you raise taxes?
So it was
for feeding children, for helping folks find a home. Would you be willing to raise taxes to meet those or are you mainly looking at austerity measures?
If I had to raise taxes to make it happen, I would see that. Now, once again, being that I'm an independent, that's a portion that I would never have to worry about. It's more I would vote yes or no on everything that they come across. So if there's issues that the taxpayers of the area don't like, I'm able to vote no on that. But I'm so sorry. But you have to remember, a lot of these programs that we want to do with the child care program, that puts so many more people to work, and that puts so many more people with higher education for higher paying jobs. I mean, that's when more people are working, that's more income tax coming in. More income tax coming in, that means more sales tax coming in because they're able to spend more. So I mean, I can't.
Candidates, 1 minute.
Okay, go ahead. Sorry.
So, Nat, just because we're on the topic of the budget,
Mm-hmm.
what's your stance on the pipelines?
About the which?
Pipelines.
The pipelines. Yes, but the pipelines. If we don't have the pipelines, we unfortunately don't have the royalties. If we don't have the royalties, now we've got more taxes that need to be paid. The big problem with pipelines is there's not enough safety protocol on them. So they say they want to bring a pipeline through, and then but they don't have the plan in place. Okay, well, what if there's a leak? All of this has to be set up well before, and it has to be staged well before it happens. So I mean, the pipelines, as much as you don't like to see pipelines.
Candidates, we're going to wrap up and move on to the next question.
Sorry.
The next question comes to us from the Comox Valley Social Planning Society.
I'll give you 1 second, okay?
The living wage in the Comox Valley is $22.02
Half and half.
an hour.
Yes. Okay, let's just go with yes. But I'm going to explain, okay? But let me explain.
This burden falls solely on small business owners right now. However, having a decent standard of living is impacted by good public policy such as government income supports, labor market reforms, including increased availability of unionization, and accessible and equitable public infrastructure and services that reduce the cost of living and improve affordability. Please give a specific example of a public policy you will introduce or support to reduce the cost of living and improve affordability.
No, I got to find this part, this one, because I did have a policy. Okay, with this one, it was my wife and I have a retail store ourselves. So when they started increasing the minimum wage, we understood it. But the one thing I always said is when you increase the minimum wage, you have to have rules to everything else. Because you increase the minimum wage, everything else has to go up. There's no question about this. So now that they've increased the minimum wage, now more people had more money in their pocket, but now take a look at the way rent is spiking again. Well, now that increase in the minimum wage didn't do anything because the rent is spiking. So to me, we have to hit more for rent control more than anything. We have to improve the rent control that we have because the rent control we have is horrible. It says you can't raise it any more than the cost of living. Well, when the cost of living is 10%, you aren't going to get a 10% raise. There's no question about this. So no, to me, a big thing is we have to hit the rent control more, and we have to figure out a way to reel in the supermarkets. I mean, myself, I like to support local supermarkets rather than the big chains. Just I figure if I'm going to be spending astronomical money, at least the smaller guy is going to get it. But no, we definitely need more help. We definitely need to do something about more rent control, because we can keep, they'll keep spiking this minimum wage and still not help the people, all because we don't have any type of enough rent control. So to me, the program with rent control would be a big help with that. That's one thing I got going. Did you have something? Oh, okay, sorry. Nobody else? Okay, anyway. Yes, I am for pipelines, but I want them to improve before they run them, because they aren't good enough right now. They really aren't. But no, because like I say, without what's that?
Pipelines eventually.
Exactly, and that's why I say I want them to be improved, and I want to be safety protocols before that. I mean, it's like when you take a look at northern Canada. None of these people have potable water, but.
So would you be saying you're for going against treaties and?
No, not at all. Not at all. No. All of that has to be permitted by the treaties, and that's another big problem. Is when they do these pipelines, the first people they should be talking to is the communities. So being the indigenous communities, whatever. Those are the first people they should be talking to, not third or fourth. Those are the first people, because there's no point on even considering this pipeline if they aren't going to allow you, because now you're just costing nothing but court cases.
If they say that they're not going to allow it, are you going to be okay?
Then they're going to have to move on. Not the trees. Sorry, the pipeline's going to have to move on at that point. Yeah. And quite often, like working in northern Alberta, when it came to the treaties, quite often they weren't against the work going on. What they were against is there was no protocols and there was no emergency setup. So I mean, like I say, if that means that they have to stage a person every 30 feet, so be it. But you're going to do what the treaty wants you to do if you want that pipeline to go through. But no, they shouldn't be able to just go right over top of a landowner's property without consultation first. There's no question about that.
But recognizing the indigenous peoples as the land.
Yeah. Oh yeah. Absolutely. No question. Yeah, they own the majority out here. You know, people don't believe it, but if it's Crown land, as far as I'm concerned, that's still indigenous land. You know? I mean, maybe I sound wrong. Yes, sir.
You mentioned rent control.
Yes.
What's your position on community housing? That's housing that's held in the public, either at the municipal level or provincial or federal level, or a combination, as well as co-op. So what are your position on that?
I'm absolutely all for that. Yeah,
and to provide tax incentives to advantage nonprofits and public housing.
Yep. Yeah, there's no question about that, because I mean, I couldn't find my answer written out here, but it is in there, and yes, because I mean, that's a system that used to always be in place. They used to always have senior centers where once you were in, your rent would never go up. Your rent stayed that until you were no longer there. And so I mean, yeah, of course, that's one of the best things that there are. It's the same thing with a young mother. Or a young father, when they get into this public housing, it's great for them. The problem is they have these goofy rules where if you make too much money, then you have to leave. You have to leave, or your rent skyrockets to something you'll never afford. You know, I watched that happen in one place.
That's a legislative decision.
Yes.
As to where that
Yeah. And like that's just it. Like I watched one girl, all she wanted to do was put overtime in to help pay for bills, help Christmas coming up, and she ended up getting her rent so high that she almost had to leave.
The next one, just wrapping up. Okay, so the next question, we're going to move on to the next question now. This next question is from the Comox Valley Early Years Collaborative. And here's the question. Research indicates that children in their early years could benefit from support, especially regarding their social and emotional wellness. What would you do to further ensure that the mental and social well-being of children and families is being supported in ways that have previously been lacking?
With that, it's more community centers for these people, for the kids and the families. More for the kids. There's all sorts of play and learn programs that go where the kids just love being there. They're learning at the same time, and it's really helping their mental health. Places like the Link, parents aren't allowed in the Link. It's only the kids, and I didn't know that until.
Are these not usually funded by municipalities?
Yes.
Right.
Yeah. But there's no reason. Yeah, there's no reason that there can't be provincial money brought into it, though.
Right.
Yeah, like I say, I mean, the government wastes so much money in so many different areas that we can look at where the waste is before we do budget cuts to essential needs, And yes, like the play and learn, the social work with parents and with kids at the same time. So much of it has helped out so many of my friends, and it helps tremendously. The people that it helps is. I talked to one of my friends when they started going, asked them what sort of difference they noticed, and they said they don't ever want to stop going to the worker because it has helped so much. They used to have a son that he acted up quite a bit, and he had problems with anger problems, stuff like that. A lot of young boys do. Going to that social worker, it really helped. It really helped calm him down. They really helped understand why this was happening. So no, it's something that it definitely needs to be out there. Absolutely.
In those community centers, we need funding for those workers
Mm-hmm.
to be in those community centers.
Yep. And I mean, if they need, yes.
Basically, we just need more funding for mental health.
That's exactly right, and that's what I've said right from the start. Yeah.
And early childhood mental health,
Yeah.
especially.
Yeah, and that's what I said right from the start too. Yeah, there's no question about that. Yeah. If we don't help the young people, there's never going to be a change. They need the help. They need more. They need the help. There's no question about it. And I mean, a blame I do a lot of times, and it's not like there's any substantial evidence to this, but to me, a lot of times it's the food we eat alone. Like how many of us just rush home and make craft dinner because we're too busy to do something because we got another sport that we have to run to. Well, to me, all these chemicals are going into our bodies and not helping us at all. So yeah, no, it's those community programs are so good for kids, and I can't walk away from them. Yes, sir.
I'm just wondering, we're on early childhood.
Yep.
And so spaces for early childhood, do you think that should be in the public sector, like elementary and high school, or a hybrid that has public and private, or should we rely on the private? And if there is a private component to what you envision, would government money be extended
Yes.
to them?
Yes. To me, it should be public. It should be public, but it needs. Geez, where was I going now? My brain is shut down on me. I'm so sorry. No, to me, it should be public. There's no question about this, because when you privatize something, it all of a sudden becomes more what's gonna benefit the shareholders, not the children. Is kind of the way I look at it, and I always have looked at it. So you have to look at what's going to benefit the children before anybody else, not benefit shareholders. Okay.
So you can see school districts.
Yes. Yeah.
The main provider.
Yeah, and that's why I was so against in the year they gave $100 million more to to private schools than they did to public schools. Well, to me, they're private for a reason. You can afford to take your kids there, so no, they shouldn't have $100 million more, you know, so. Yeah. Anything else? You seem to have some great questions. That's why I keep looking straight at you. What's that?
45 seconds, candidates. 45 seconds.
You do have great questions, though. Yeah. Yeah.
Just like the other guy even more. So they will vote for their, just to prevent them from getting in. So it's an uphill battle.
I brought the wrong pamphlets, didn't I? My other one had my website on the back. The brochure, the entire brochure is right, but I had my QR code for the website on the back.
To wrap it up, it is actually time to move tables now, so we're going to get John Devin to move over to table 2, Arzina Hamir to move to table 3, and Devin Howell to move to table 1. The Immigrant Welcome Center's 2003 Needs Assessment research shows that many immigrants who live here are unemployed below the level of their skills and expertise. How would your party reduce barriers to employment so that newcomers are not underemployed?
Well, first of all, I'm independent. I'm not part of a party, so I can guarantee that I would never go anything again that would stop the immigrant process. When it comes to being underemployed, we have to make changes to the laws. So we've got all sorts of doctors, all sorts of nurses that can't work in their field. We've got all sorts of electricians, plumbers, HVAC guys that have nothing but experience, but they can't work in their field because we refuse to acknowledge these people. What they have to do is it has to work with the federal government and the provincial government at the same time, and start accepting these doctors. If that means that this doctor has to shadow a Canadian doctor for 2 years, so be it. But that's 2 years that we have a doctor working. They came from a country that they were able to keep their people alive for a long time. They'll continue to keep them alive. Our bodies aren't any different. There's no reason they can't be doctors here also. They can't be nurses here also, or any of the other building trades. I understand maybe they have to take a couple of courses. Maybe they have to get back into apprentice, but they don't have to start from day one either. They've got the experience. So we need to help them with that. Any questions on that one? Wow.
Experience. I know I have a relative who couldn't become a pharmacist here because of the language accent and the difference of prescriptions there in Korea and here. And so,
but there's no reason we can't improve with the ESL programs too. You know, yeah, no, and I understand that, but we can always do something to make this work. We've got all sorts of a population that aren't able to do what they're trained to do, you know. And I mean, for them to go from being a doctor, something they love, to driving a taxi, something that they aren't going to love, isn't right either. I mean, lots of people enjoy driving a taxi, and there's nothing wrong with that. But a doctor would rather be a doctor. An electrician would rather be an electrician. You know? And if that means we have to upgrade on our ESL programs, we have to do it. You know, we have to invest in everybody. Any other questions? I'm sorry if I'm kind of seem like I'm coming at people I don't. I normally try and sit down, be at the same level as everybody else, but they asked me to stand for this, and I'm not too sure why.
Nurses, what would you do to help promote bringing new nurses that are immigrants to make it easier for them to start working?
That goes back to the medical board allowing them. You know, because if the medical board allows them, They've got, they're able to pass their English test. There's no reason they can't jump straight into work. My wife, she's an immigration consultant, and something she does every so often is bring people in for specific jobs. It's tougher to do, but there's no reason for it to be. To me, like Alberta once, they brought in a whole bunch of nurses from the Philippines, and it was they were on a shorter term contract. But while they were working, they were able to take courses to upgrade their nursing degree that they had, and actually be a nurse there. After they got their LPN, they did some more, and they became RNs. But they were able to do it at least, and they didn't have to start from day one. Yeah. And a lot of the immigration is a federal level, which is so broken. It is so broken right now. My wife, she has no idea how. She keeps telling me she has no idea how the Canadian government is even going to remotely come close to fixing the problem they've created. No one else? Oh, I'm just getting dry in here. Must be nervous. Yes, sir.
Do you have a website?
Yes, I do, and it was here, but I've got a QR code. So if after this we can go to my truck and I can you can scan this QR. I apologize for that. I didn't realize that I brought the wrong ones. Because there was a QR code right here for you guys. It's a Wix website, so unfortunately it's a lot more long-winded than it should be. But I've also got another email.
Candidates can wrap up that question, and we're going to move to the next question. You're doing great. We're getting there. Okay, so this next question is from the Pride Society. So it's asking candidates, please note 4 specific actions that you will take to support and foster the growth and safety of the trans community in the Comox Valley.
Where'd it go? Oh, here it is. Okay, for that one, my four action plans would be building community alliances, partner with local organizations and businesses to create safe spaces for trans individuals to gather access, resources, and connect with one another. Because a lot of times, knowing a few, I know that they feel alone no matter where they go. So let's give them a place where they can be together, where they can discuss the problems they have been having, and basically vent. A lot of times they have nobody to vent to, and a lot of us just need that. Promote awareness campaign, launch community-led initiatives to educate people about trans issues, reducing the stigma, and fostering understanding and acceptance. The stigma is the biggest thing. The stigma is the same as with somebody having a drug problem, an alcohol problem. We have to get rid of the stigma. If we don't get rid of the stigma, they're never going to feel safe. They're never going to feel comfortable anywhere. So we have to be to the point where if you see a trans or a gay or LGBTQ, you have to look at them just like you would with anybody else around you, because they're humans. You have to look at them as if they're humans. And unless you look at them as if they're humans, once again, they're never going to feel comfortable. And they have a right to that. Facilitate peer support, establish peer mentorship opportunities to connect trans individuals with supportive allies and mentors for guidance and community building. And once again, that goes back to a lot of the public spaces. We have to have a place for them to talk. We have to have a place for them to see if they can figure out ways to fix some of the problems that they're coming across. And once again, venting is the biggest thing. I'm the type that I have to talk with my wife. I have to vent out my problems for the day every so often. She has to vent to me every so often. It's something that needs to happen, and these people they deserve to feel like they belong somewhere. And enhance access with local libraries and community centers, provide informational materials and resources tailored to the needs of the trans community, ensuring they have access to crucial support. And once again, to me, that's just like a support center. You know, we have them for kids, we have them for families, not enough, definitely don't have enough, but they need it, absolutely. It's, a lot of times they lived a long time without being able to express themselves. Now they've decided they want to express themselves, they're going to push to express themselves, and it's a very tough decision for them to make. And I've got no question about that. So yeah, we need the education on how to support them just as much as they need the support. And any questions on that one? Yes.
How many queer events have you been allied with and been integrally involved with?
With our retail store, we did go to the one at the Lewis Park, but then when it came, there was an event a couple of years ago for the queer event, and we took our staff there, and because they are in full support. We have a few working for us, and then this year for the parade, it looked like it sounded like they didn't want the politician there, so I didn't want to go be there if they thought I was just trying to get a couple of votes, because that's not what I do. I'm not going to go to something just to get votes if they don't want me there. It's not right in my mind, you know. I mean, I'm all for, you want a parade? Yeah. You want to have a gathering? Yeah. Do it. All for it. I see nothing wrong. You know, you deserve it. I mean, if they're going to have a parade for Canada Day, they're going to have a parade for anything. Why not?
Did you participate in the parade?
No, because what I thought was they didn't want politicians, and since I was trying to be in as a politician, and then after it was done, I saw a picture of Jagmeet singing there. I'm like, I thought they didn't want any political activity in that one. So
you wouldn't have supported that community in your human persona?
Oh yeah. No, absolutely, I would have. There's no question. But I wasn't here. Also, we were in Vancouver.
All right, candidates, the time is up on that question.
No, I'm
all
all for supporting. No question. Absolutely. No, we actually got it.
We're going to move on to the next question.
I will come back to you, okay? I promise.
This comes to us from the Comox Valley Coalition to End Homelessness. And the question is, many policies aimed at addressing homelessness are not meeting the needs of those most impacted by the housing crisis. How do you plan to meaningfully involve people experiencing homelessness in shaping policies, programs, and priorities that directly affect them? What strategies would you use to ensure their voices are central in developing situations?
Once again, that goes to places like Maple Pool. Maple Pool has a wonderful thing going. I cannot remember the family that started it with the sea cans, the 20-foot sea cans by 8-foot sea cans, being stationed at Maple Pool for the homeless. It's a wonderful program. We need more programs like that, and we need to have them believe they have a sense of worth. Lots of times they don't believe that they have a sense of worth, and they do. Every one of them do. If they don't have that sense, then they aren't going to want to improve. They're just going to believe that if I improve a little bit, I'm just going to be five steps backwards anyway, and that's not right. It's they need the help. We can't turn our backs on them. They are human beings, like I say. They're part of the community, and we have to do everything we can to help get them off the streets and into shelters. There's no question about this.
So what policies would you promote in the legislature that would accomplish that?
Well, first of all, we have to give them more money. We have to offer more money to the shelters themselves.
Do you think shelters are the best solution?
It's one of the solutions.
Shelters like the Connect Center?
The shelters like at the Maple Pool with their sea cans.
Oh, okay.
Okay.
So
No.
you're talking about providing housing?
Yes. Yeah. No, it's. I'm sorry. I'm not a career politician. You can tell. Well, you can clearly tell on that. But no, I do have a lot of views that to me are what will help this area. And with my views, I don't have to go back to a party to get permission for this view. I'm allowed to have my views, you know. And but no, it's increased subsidized housing, rent control measures, cooperative housing is a great tool. You know, the supportive programs is a great tool. All of those are things that are needed because the situation is getting worse and worse and worse, especially after the oxycodone years. And still a time I can't understand why the manufacturer, nobody in that manufacturer company had to spend any jail time, but that's where a lot of it started. Not all of it. That's where a lot of it started. I'd like to see more inspection. I'd like to see more work with China because that's where unfortunately a lot of the heroin comes from. I'd like to see more work with them about when it is found in our ports, of what they can help us with to stop more from coming in. You know, once again, that's unfortunate at federal level, but at the same time, we can't start. There's no reason we can't start it. The talk has to start somewhere. It's just like when you have to have the drug and alcohol talk with your kids. It has to start somewhere.
So John Hedican's position is that we need drugs legalized so that there is control
Yes.
over the supply that hits the streets and hopefully less toxic
Yeah.
drugs.
Yeah. No, I've talked to John with that, and I've got respect for John. But as for legalizing them, I don't think is the answer. I mean, other countries, like a perfect example is Portugal. And now, I don't know if Portugal is the right answer either, but they didn't legalize it, they decriminalized it, which was a difference. So now you can be caught with up to a 10-day supply on you. Now, if you're caught with that 10-day supply, you aren't charged under any type of a criminal code. But from there, you have to go into an assessment. So from the assessment, it decides, okay, well, is he like a daily user, an hourly user? Is he a chronic? Is he so bad that he has to have treatment? They go into assessment like that, and then they decide what sort of treatment you're going to have after that. So you do get a fine, but they do decide if you're going to get treatment or if they're just going to let you go at that point. So I can't say 100% legalization is the answer, but there is a chance that if we could come up with rules, with proper rules, maybe decriminalize is the answer. But yes, and that goes back to there was no rules attached to it, none.
Okay, we're going to move to the next question.
This is something else I would like to talk to you about after. I really would. Yeah. My wife and I will talk to you about this after, if you have the time.
Comox Valley Senior Support Society. Affordable, accessible, and interconnected public transit can address many social issues, including equity and inclusion, climate change and quality of life. How do you perceive the role and future of public transit? What changes, if any, would you work towards and advocate for in public transit improvements in the Comox Valley, Vancouver Island, and beyond?
First of all, the public transit should be free. There's absolutely no question about this. The amount of money that stupid meter brings in every day does nothing for the roads. I mean, we subsidize the entire bus, we may as well subsidize the riders too. It does nothing for them. So we get rid of that, more people will start riding the bus. More people start riding the bus, that's less vehicles on the road. So get rid of the fee right off the bat. The buses, we can get more buses. The problem is we don't have enough people willing to drive the buses. So we have to be willing to train people. There used to be a program with the EI department where if you're on EI, they would put you into training. I know several people that got their Class 1 license because of this program. It's time to bring that back, because people that are laid off from a seasonal job, they could go on to getting a 1A license and start driving bus. The bus driving wage is actually much better in this valley than what I expected it to be, especially when I compare it to any of the other trades. They're right on par with all the other trades. So to me, get rid of that first, and then we need a handy dart or a couple of handy darts that go from here to Victoria. Because right now, there's no way for anybody to get to Victoria unless they hop onto the transit. They have to transfer 3 or 4 times before they get there. Well, let's get them onto a handy dart so that they can get there in one go rather than 10. And getting on and off on a bus isn't exactly the easiest thing if you're stuck in a wheelchair.
When we legalized alcohol.
Anybody think? No? I must be really boring for you guys.
I think free public transit is a great idea, but it's also true here in the Comox Valley that the bus system is pathetic.
Yeah, and that's because they cannot get the workers. That is the biggest thing.
You see these huge buses that are empty.
Yeah, no. Yes, that's true. Oh, sorry.
So how are we going to pay for free public transit?
Have you ever seen the amount of money that comes into that little meter every day?
I have.
Yeah, it's not that much. It's not much of a difference from, we're already subsidizing the entire bus. We may as well not be charging people at the same time. You know, like you see these drivers, and they have a lady coming on that's counting her nickels and coins to be able to ride the bus. And then you have some young guys coming on like, oh yeah, I'm 12, because they don't want to pay the fee. To me, just get rid of the fee. You know, because you aren't going to notice enough of a difference per area to understand this, because it's a very small amount that goes in there. Very, very small. Yes?
I guess to expand, have more drivers, to expand the routes, the timing.
Yes.
You miss one bus, you have to wait.
Exactly, and that goes back to trying to find workers. You know.
They have to pay for that.
Yeah.
And they have to pay for the more routes, more bus drivers.
Yeah. Yes, it is, but like I say, the amount of money that's coming into that little meter isn't making the difference anyway. And all of that money, all that goes to is to the transport department. It doesn't even actually go to it. It doesn't go to fuel. It doesn't go to tires. It goes to the actual transport department. So, yeah, to me, make the busing free. Get people to on the bus at least. And like you say, we need better schedules for the buses also. There's no question about that. Yeah, you miss one bus, you're done. And then heaven forbid to get somebody new working for them, they'll blow right past you. They don't do it on purpose, but they'll completely miss your turn, especially in the winter time. Yeah. Yes, sir.
What would you think about electrifying the buses or turning some of the buses to using hydrogen fuel cells?
I see nothing wrong with that, but I think it was Edmonton. They tried going with electric buses at one time, and they had nothing but problems even in the summertime. So I'm all for it, but I think they need to improve the technology a little bit more first. Yeah. No, I'm definitely all for it. I mean, we drive electric car ourselves. We're quite happy. I mean, don't know if we'll buy another Tesla, but might go something different this time. You know? They definitely got yes.
What hours do you think the buses should run?
To facilitate everybody, it should be no later than 6 a.m. And they already go, I think, till about midnight, as far as I know. And so, yeah, no, if they improve the hours they have, but get more routes going, faster routes, I think it would be much better. Yeah, I think that's what we need.
All right, this question comes to us from the Comox Valley Substance Use Strategy, run by the Indigenous Women Sharing Society. People who use substances and Indigenous people report to us regularly that they are experiencing systemic racism and poor quality of health care. What will you do to ensure healthcare workers and law enforcement workers are provided with significant anti-racism training and monitoring to create culturally safe spaces and address systemic racism and discriminatory practices?
Yes, that is a major issue, especially in the healthcare and especially with the police departments. Once again, these are human beings. They deserve to be treated like human beings. If they're in the hospital because of a problem, they have to be looked at as human beings. They have to be looked at as it's the same way you will look at every single other person. And yes, so there has to be more training. There has to be more removing the stigma of it. Everything. The training is the biggest thing, but you have to be, these people, the workers have to be willing to accept the training. They have to be willing to learn from the training. And if they aren't willing to learn from the training, then we're going to have to start more reprimands, because there's no reason that anybody is treated different from one person than the other. Were you going to ask something? Oh, I thought you were about to ask something. Sorry. Yeah, but no, it's quite simple. They're human beings. We have to treat them that way. More training will help. It's just we have to find a way to make the workers accept the training and learn from the training and carry on with the training. They have to believe in this. Until we make them believe into it, the change can't happen. So, yeah, I'm all for the safe spaces. I'm all for heavier training with everything that becomes everything out there, with police, with the healthcare, and right down to the bus drivers too. They all need it. I've got no question.
But that doesn't address or I guess maybe it does kind of address the systemic
yes,
racism.
and that's why I say,
Truth and Reconciliation Day,
Yeah.
and the governments federally and provincially have done pathetically little in terms of addressing the calls to action.
Yeah.
So training frontline workers doesn't address the systemic discrimination that is built into the system.
You're absolutely right. And I was just watching the news the other day about Trudeau. He was going to address all these issues that came up. Well, he's addressed maybe 3 of them, and it's not right. Absolutely, it's not right. That's an argument I've gotten into a lot of people with a lot of people, and they don't understand that people with problems normally, whether it's racism or whether it's substance abuse, normally there's another factor into this. So I mean, like when it comes to alcoholism, a lot of people don't realize what caused that alcoholism in the first place. It was most likely a traumatic experience. It wouldn't have been because they had a bad day that day. It was most likely a traumatic experience. And they started with using that to mask that traumatic experience. Now they've gotten into something heavier to mask that traumatic experience. So unless people get rid of that stigma and admit, yes, we made mistakes in the past, we are going to learn from this, and we are doing something, nothing's going to happen. So no, that's something that I'm quite happy to fight with Trudeau about, fight with EB about if he has problems. But no, I'm all for standing up for that, because the stigma has to be gone. There's no question.
So one part you mentioned training, but what about monitoring? How will you monitor the health authorities and address the perpetrators not working?
Well, and that's why I say that's where the reprimands has to happen, because the reprimands aren't happening enough. And when they do happen, it's not enough of a reprimand that they were given. So that has to go up. And now they're willing to fire a lot of healthcare workers because they weren't willing to get a COVID shot, but they aren't willing to fire somebody for getting into a racist war with somebody. I mean, you got to really start looking at your battles on this. If they didn't want to get the needle, there's all sorts of masks that they can wear. We need them, but if they're to that point, eventually you have to do something. You have to get rid of them. Yeah. But like I say, it has to take training, and it has to, if the training isn't working, then it has to start with reprimands. Once you get to the reprimands, normally the rest start thinking, oh, they're serious about this.
Okay, candidates, you can wrap that up. We've made it to the last question. We're now going to the very last question. You've almost made it, folks. You're doing great if you're still here. This last question is from the Comox Valley Food Policy Council. The Comox Valley agricultural community is facing several challenges, including high land prices, increased cost of getting inputs to the island, and climate change. How would you support farmers and the local food system?
Subsidies for the inputs and transportation, because a lot of these high costs of the inputs are on the ferry or are on the barges bringing this stuff over. So subsidies on that. We had all sorts of practices in the past where if it was farm equipment coming up from the States, there was no provincial tax on that farm equipment. We can have the same thing with this. If it's inputs for farming, then there's no reason that they should be charged a ferry. I mean, that's a few trucks a year. I mean, sometimes it's quite a few trucks, it depends on the season. But with that extra ferry cost, that increases it dramatically for the input costs. We can get into co-ops where we're buying much larger amounts for the farmers to store. So if they're buying the higher amounts, that's less transport costs once again that they're paying for. We can start promoting more locally grown food is a big thing. So the farmers, a lot of the crops that we have are actually germinated from a previous crop. So luckily, a lot of the crops that we have, we don't have to buy more than once, maybe a few every couple of years, sort of thing. So subsidies towards the trucking and the transport, to me, is a big thing that'll help. Once again, we can get into we can get into food programs. So a lot of the food that we're buying is from here. We are bringing the food from another part, from somewhere else. A lot of food, unfortunately, we can't, so we have no choice. But subsidizing the trucking is a huge thing, and then that gets even further with the water rights for for a lot of the farmers. All of that will help drop their cost, their annual cost to operate the farm. I mean, the carbon tax on farm fuel shouldn't be there, just like the carbon tax shouldn't be there for us to heat our homes. You know, farm fuel, that's the fuel is what's keeping us fed. So we've got all sorts of ways we can save on the farming. It's just we have to fight with the government to do this, and once we get the fight going, that's the biggest thing, is start the fight, keep it going. Eventually, they have no choice but to give in if they want to keep their seats. Any questions on that one? Yes, ma'am. No, I'm all for you. No, I love it.
So you said farm fuel and taxes on farm fuel, but do you agree that we need to help our farmers get off of fossil fuels given the climate emergency?
Yes, but the problem is a lot of the machinery they haven't made to get off of it.
So how can we get our farmers off of fossil fuels
See,
in a way that's affordable for them?
Yeah, and that's just it. We have to get them. They have to be, first of all, they have to make the machines to do it, because right now they don't even make them.
There are some, but they're hugely expensive.
I've never seen a combine that was on.
I think there is a combine, and I think there is a tractor that both are electric.
Is there? Okay. Well, for that to happen, we would, first of all, we have to increase our electrical grid then, which is fine. I've got nothing against that. I'm all for increasing the electrical grid, but at that point we'll have to increase the hydro dams that are producing the electricity. which once again I'm fine for. But getting to that is such an astronomical amount that we would have to look at different high tax breaks for them to be able to buy one of these machines, because right now it used to be you had a machine, you had it until you could not get parts for it anymore, and then it became okay. Well, now you lease the machine for a year and you get a new machine. But the problem with that now is if you lease that machine for 1 year and then get another one the next year, it's such a huge amount that you can't. No matter how much your farm brings in, especially the farms out here, they aren't that big of farms. You aren't going to be able to get that paid off. Like you'll never make the payments on it. You know, I mean, I'm all for it if it can happen. I really am. But there's the technology. I just don't think it's there yet. It's a big thing. Even.
I'd like to thank you for coming out tonight. Thank you for enduring 2 hours. It's been a long haul for you, I'm sure. And thank you for being here for the second half as well.
Yeah.